All right, welcome everybody. Today is March 29th. I hope everyone is doing well. Welcome to this week's edition of It's Worth a Shot, sponsored by Mount Pacific Quality Health. My name is Jessie Kinsey. I'm a registered nurse and account manager with Mount Pacific here in Montana. And we have two of my coworkers presenting today. One joining us from actually just across town here in Montana, and the other joining from Alaska. And today we'll be talking about just taking a look at the COVID-19 outbreak assessments that we do, infection control assessments, and some of those common concerns that we've identified with some ideas to mitigate, as well as taking a look at something a little different, C. diff infections. Next slide, please. Update for this week. We do have one more NHSN training opportunity coming up on April 10th. You can register now, and we will be taking a look at the flu reporting, the deadline that will go into effect here actually in May for nursing homes. So just taking a closer look at what that influenza vaccination summary data should look like when you're reporting into NHSN, specifically for the long-term care communities. Again, that's coming up April 10th. So we'll drop a registration link in the chat box. Feel free to register. And then if you have any questions you'd like us to review or bring up during that training opportunity, just reach out, let us know. Be happy to include it. As always, if there's one person thinking it or wondering, then there's likely other folks that have the same question. So feel free to reach out. Next slide, please. As always, feel free to add your webinar topic, clinician ideas, or needs into chat, and we will continue to meet every Wednesday. We do have a polling question for this week. Are your staff aware of location of pharmacy e-kits and contents, including how to access in your facility? And don't forget to consider your traveling staff and how, when they receive their orientation to those e-kits, emergency kits, and contents. We'll just give you a few moments, see if we can get at least 20 people to respond. Just a few more people. Again, polling question. Are your staff aware of location of pharmacy e-kits and contents, including how to access, and take into consideration your traveling staff? Like we still have some folks joining us from the waiting room. All right, Mary, it looks like we'll go ahead and close that polling question. As always, thanks for participating. All right, our weekly influenza snapshot, we can say we have been on the downhill slide of our weekly influenza cases. We've definitely seen a continued decline, which is wonderful news nationwide. However, just keep an eye on your neighborhood still. We still are seeing some increases in cases and activity in some parts of the country. And those are the same states that we've kind of been monitoring now for the last several weeks. They're still fighting through some higher than average influenza activity in their neck of the woods. All right, next slide, please. Quick review of our COVID-19 updates for this week. Cases are on the decline. We did have a little bit of an uptick in deaths. Again, there is some data delay that plays into this weekly summary. So taking that into consideration, this may not be as live as we would want it to be. Decline on hospitalizations, and we're maintaining about a 16.4% COVID-19 bivalent vaccine uptake. So still plenty of opportunity to get your vaccination, and it's still proven to be the best method of preventing severe hospitalization and death. Next slide, please. And then, oh, I inserted this because I just wanted to show you guys that even though nationally we're seeing a decrease in COVID-19 cases, we're still having pockets of higher than average activity throughout the country. So just being mindful of your community and your state transmission levels as people are moving around, of course, for spring break. We do have some high activity in parts of Alaska, Montana, and some medium activity into Wyoming. So again, just being mindful. Next slide, please. So with that, we have our first guest speaker that will be going over site identified issues, these infection control visits and support that we offer related to COVID-19 outbreaks. Shay will be going over processes, issues identified, and resources. Shay, you have the floor.
Thank you, Jessie. Again, welcome everyone to this week's Worth a Shot presentation. My name is Shay Trafton. I'm an account manager for Mountain Pacific here in Montana. My background includes aspects of community health, long-term care, healthcare operations, and human resources. But today I thought I'd take some time and go over a few of these site identified issues that we're seeing as it pertains to my role as an account manager here at Mountain Pacific. Next slide, please. So as a lot of you may know, Mountain Pacific receives referrals for any facilities reporting 5 or more positive COVID-19 cases within a facility. These cases are reported to Mountain Pacific weekly, and it's based off of the data that you guys enter into NHSN. And then with this, as an account manager or the account manager in your state, your facility will be contacted and we'll go through an assessment to see where we can provide assistance. This process will encompass aspects that are mandated by CMS, as well as best practices shared forward with us from other facilities to help mitigate COVID-19 and or control outbreaks. So through this non-punitive process, we will provide the facility with a magnitude of resources, really a fishbone for your root cause analysis. And this can be used in other areas within your facility, but this just provides you a great opportunity to kind of dive into why maybe you had a COVID outbreak within your facility. And then lastly, what Mountain Pacific likes to provide you guys with is a implementation plan. So this encompasses a lot of aspects that you can include in your presentation within your facility, and then hopefully help you identify areas of improvement. Next slide, please. So as I'm going through these facilities, we are across our areas in Wyoming, even Alaska, Hawaii, and here in Montana, we are looking for kind of commonalities. And these are a few that we've identified throughout our region. The first one being hand sanitizers. This is where we would go in and we see that you make sure your hand sanitizers aren't expired. Are the hand sanitizers the correct alcohol percentage to kill the appropriate bacteria or viruses? And then do you conduct audits to determine that all hand sanitizers are full, and then make sure that those hand sanitizers are not clogged? A lot of times you can go around and it seems like you look at them and they're full, they have the correct date on them, but when you go to use them, there's like a plug at the bottom. So we just want to make sure that those aren't plugged and that everyone is taking their time to audit those and make sure that we are using the best practices going forward with all those hand sanitizers. And then another thing that we've identified is that sometimes staff are bringing in their own hand sanitizers, And again, we don't recommend this as sometimes you can get those hand sanitizers from places and they don't have the proper percentage of alcohol in them, and or they're topping them off. So that's another concern we don't want to see, is make sure that you guys are not refilling those hand sanitizers. So again, some things to think about when looking at an audit for your hand sanitizers. And then the other thing that we're looking at, and we know it's a real thing, is the PPE fatigue. So we try to focus in on that PPE compliance. So these are things like ensuring that masking is offered and worn per regulations, and that you guys are taking steps to mitigate PPE fatigue. So whether that be making sure that everyone is getting a break, or just other options. We've heard of, providing gift cards, just providing resources for your staff to make sure that these things are identified, and then you're trying to avoid the misuse of PPE. Another one that's come to our attention in the recently, is that housekeeping when mixing and your cleaning chemicals. We'd like to make sure that they're wearing the appropriate PPE. A lot of times this is face shields or goggles to make sure that that splash doesn't come back up into their eyes, or they're wearing the rubber gloves as opposed to latex gloves to avoid any type of burns to the skin. And then here again is another area that we can focus audits on, and just making sure that PPE is there at the mixing stations and or around the facility. And then again, as we look at PPE, fit testing has become quite an issue across the region. We would like to see more people able to fit test within their facility. We are currently working on options for that, but then still every employee should be fit tested no less than annually. So again, we are trying to focus our attention on areas or barriers around fit testing, whether it be getting the appropriate N95s in, or actually getting the appropriate equipment to fit test. And then donning and doffing, again, we've had facilities get dinged on this as when they're needing precautions. Sometimes the donning and doffing isn't taking place where it should. Sometimes even though you're putting up laminated signs, the donning is happening inside the room, where technically it should be happening outside, and vice versa with the doffing. Just make sure that you're doffing inside the room prior to coming out. And then also a helpful hint with this would be to maybe offer signage on the inside and the outside of the door. So therefore the employee or staff member is not, tempted to exit the room in order to look at those procedures. So just a couple quick tips for that, and then make sure the garbage cans are on the inside of the room. That's also helpful. If you guys are looking for precaution cards or any type of those things, please do not hesitate to reach out to me. We have seen a lot of facilities with a lot of neat precaution cards, and I'd be happy to share that forward with you. Also, as we look at all these issues identified, I've mentioned audits under each one of them, as audits are a great way to capture the facility's efforts as well as support your compliance. So we are looking at making sure that these audits are done not only throughout the day, but then also 20% of these audits need to be captured in the off hours. So those are outside of your normal Monday through Friday range, 8 to 5. So we like to see that, again, 20% of those are being done. And then obviously audits can be done almost in every department, but we like to see specifically areas such as hand hygiene, PPE compliance, those hand sanitizers, environmental rounds, housekeeping, whether it be cleanliness of rooms, railings, high touch areas such as railings. And then again, those are just a few that we like to focus on, but really make sure that you're conducting audits to support your efforts. The last thing that's really come to our attention too is the infection control policy and procedure. A lot of the facilities don't have a comprehensive infection control policy that entails aspects for addressing annual review of infection control processes, an outlining of the infection control committee, who that's going to be, and when you guys are going to meet to discuss infection prevention. And then the process for maintaining and implementing infection control policies and procedures. So again, those are just a few things that we've identified throughout these facilities. And we just wanted to bring that to your guys' attention, that again, these seem to be the areas that are frequently coming up in these site visits. Next slide, please. So Mountain Pacific, obviously, we want to help you in as many areas as we can and provide you with many resources. So we have developed a weekly kind of snapshot of what we call sharing out suggestions. So these are your tags of the week. What we do here is we look at our 2567s across the region that we deal with, and we identify tags that are being frequently addressed or tags that are unique. So we take these tags and we do the research on it. And these are essentially hot topics, so to speak, and we're going to provide you with resources, the tag itself, and kind of a description. And then also we like to pull actual verbiage off of those 2567 so you can see what exactly we are what we're looking at as to why this facility got tagged. So again, these go out on Wednesdays. Let's send it out to all our listservs. So if you're not on the listserv, please let us know, and we'd be happy to add you to that. Next slide, please. So here's a few of the tags that we have identified and we've sent out. And given the time, I'm not going to go into all of these, but I just really wanted to capture what a few of the ones that we've kind of identified as being very prevalent across our area. So again, here's just a couple. If you want some information on this, please reach out to me. I will put my information in the chat and I can forward you that information as well. Next slide, please. So with that, I guess I appreciate everyone's time and attention. I just wanted to bring to light kind of what we're doing, what areas we're identifying. And then if you guys have any questions or topics for next tags that we should identify, please don't hesitate to reach out. So with that, I'd like to pass the baton over to Lori Kachoyak. She is my coworker, and Lori, you can have the floor.
Shay, thank you so much. That was awesome. And I have to say, I have been loving the SOSs. So I saw a comment in chat about the listservs. We will be sure to get those out to you guys. And it is great information. If for some reason you're not receiving them, please reach out and let us know. We'll make sure that you are on the appropriate listserv so that you're receiving those each week. So now on to poopier discussions. No, just kidding. But let's talk a little bit about Clostridioides Difficile infection. Next slide, please. So just an FYI, the reason I said Clostridioides Difficile infection is because in 2016, we actually decided to reclassify this bug. And the family actually was changed and a new one was created, a whole new family, just so we could still say C. diff or CDI. Believe it or not, scientists think about us common people sometimes too. So there you go. So I will mostly refer to it as CDI when I'm talking about the infection, but just know that proper term updated. So, and the bacterium, by the way, it can be a normal part of our intestinal flora, especially babies. As we get older, less of it's found in our flora, in our gut, but it is still there for many people. And it's not normally a problem. It's not normally a problem unless the other flora in our gut gets suppressed. So this can happen, for instance, if we use antibiotics inappropriately. So notice on here, one of the bullet points is that at least 15 to 25% of our nosocomial, which means healthcare associated antibiotic diarrhea, is is caused by our over antibiotic use or inappropriate antibiotic use. So those spores, they can cause symptoms, and then we get a big problem with an overgrowth of the bacterium in our gut, and thus it leads to infection. And just an FYI for our long-term cares, about 9% of all of our CDI cases in the US came from long-term care. Next slide, please. So, how do we recognize C. diff? I am not near this creative, but I had to love this developed for home flyer, actually. And it talks about Clostridioides difficile and the symptoms to watch for. I really liked that it listed them out there very clearly, but even more fun is the poop, right? So I love how it's compared to food. I hope all of you have had lunch. Hawaii folks may be getting close to lunchtime right now. Alaska's about getting out of lunchtime, and the rest of you hopefully are done, because otherwise that can look, I know, a little gross, but you got to know your poop. So if you're going to test for Clostridioides difficile, the only appropriate type to test for is type 7. That's that watery diarrhea with no solid pieces. So even if it's what I would call like the chunky monkey stage, a mushy oatmeal like type 6, nope, it needs to be runny. And you need to have at least 3 episodes of that within 24 hours before testing should be even considered. And you've got to think about other situations for reasons people might have diarrhea as well. Next slide, please. So I thought it would be good to take a look at Clostridioides difficile infection rates in our region. So just an FYI, we have that dark blue line that's a target that we want to shoot to stay below. And so as you can see, for our long-term or our long-stay residents, those rates are kind of, this looks back a couple of years. And granted, the data always lags, so our data doesn't quite go through all of 2022. But as you can see, for our long-term care residents who are long stay, we're above that target. So we'd really like to find some ways to get below that target. One of those reasons we know can be that in a small facility, which many of us are in small facilities, one case of CDI can impact the rates. But we need to know our best practices. So let's talk a little bit about what we can do to help prevent CDI. Next slide, please. So we need to have a programmatic approach, really, for tackling the problem of CDI in our long-term cares. Let's look at each of these little bullet points, not really bullet points, but, but each of these sections to this process. Next slide, please. So really, before the poop hits the fan, I hope that the first thing we do in our facilities is prepare. We need to engage a team. That team could be part of our QAPI or our infection control group, but we need to develop policies and processes in our facilities so that we're prepared. Make sure that you include regulations and reporting requirements as part of your policy, and include prevention means like antibiotic use. Having an antibiotic stewardship committee in place, make sure that we use best practices when it's related to an antibiotic, i.e. don't treat all urine cultures with antibiotics. So just going down that track, making sure you have a formulary. Make sure that that formulary is regularly reviewed at least every time that your antibiogram is updated. And speaking of antibiograms, remember that that shows the susceptibility of bugs to drugs. So that should be regularly reviewed. If you're in a smaller facility, that may come from a local hospital or your local region, or your state may produce them and then put them out either by your state or your region to refer to. Remember, the lower the number, the more resistant that bug is to a drug. So if you see resistance increasing to a certain antibiotic, consider changing that antibiotic. We need to educate all of our staff as well. Be sure that they know the appropriate antibiotic stewardship pieces. Be sure that they know all the prevention pieces for CDI. And when I say all staff, I do mean including your environmental service team, your healthcare staff, your leadership. Everyone should be aware of how to prevent CDI. Next slide, please. Having a detection method for CDI is important. So have surveillance and appropriate testing methodologies in place. Look for residents that have diarrhea, see if they have other symptoms of CDI. And if they do, be sure to test early. Don't wait for it to go on for days and days. Test as soon as appropriate. I was doing a little research and I ran across Minnesota Department of Health. If you guys haven't checked them out before, it's a great resource. They put out, they have a really nice group that regularly puts out good products. So, so this is one of them. They have a nice little CDI response algorithm. I know it's probably small on your screen, but we do have a link to it at the end. So but consider using some sort of algorithm or process in place where you have a means that's already in place if you do have somebody that gets CDI symptoms, so you know how to test and treat and how to appropriately follow up after that. Be sure you have surveillance in place for tracking and benchmarking. And I would suggest, and I'm just going to toss this out here, I hope nobody cringes, but the CDC's NHSN program that I know everyone is using because of reporting to COVID also has a module for reporting lab ID events for long-term cares, and that includes CDI. So that just means that the data in there, you don't have to put a lot of information in. It's completely lab-based, meaning it's just based on the test. You don't have to put a lot of patient or resident information in there. So consider using it if you haven't already. Just a little plug for that. So what happens if someone does develop CDI in your facility? We need to contain that, right? So beyond detecting it, like what happens when they get it? We don't want it spreading to other residents. So we need to remember appropriate hand hygiene. Part of education needs to be included that alcohol-based hand rub does not kill C. diff. So be sure that people are washing with soap and water. That is essential. Make sure that we're using transmission-based precautions. So make sure that appropriate PPE is used. Shay did a nice job of talking about that earlier about PPE, and it's not only for COVID, but of course for other things as well. This is a great opportunity, of course, to utilize PPE appropriately. Make sure that we're doing effective cleaning. It's critical to remember that not all products, not all of our typical disinfectants will kill COVID. Refer to that EPA list K and choose an appropriate disinfectant. Bleach is commonly used, so just be sure that your environmental service team is engaged and aware if a resident has C. diff, and be sure that appropriate cleaning methods are used. Next slide, please. And I'm not going to get into this too deeply, but just remember that the CDC has a great toolkit that talks about the core elements of antibiotic stewardship. They're listed here. Refer to them and utilize them as you're putting together or using your antibiotic stewardship committee. Really important that you have an interdisciplinary group that's a part of that committee. Make sure, I know the third bullet down says drug expertise. The hospital version of the core elements got updated to say, quote, pharmacy expertise. So I'm sure that'll be coming for the long-term care one that you see here. I left it because that is current here, but our pharmacists are drug experts. Be sure that you have a pharmacist engaged in somewhere in your QAPI team or your infection control team, but make sure that they are a part of your antibiotic stewardship program. Next slide, please. And I know we are at the top of the hour, so I'm not going to really get into these. The next two slides are mostly reference for you. They note that in an update of regulatory terms that they did add an actual definition for CDI just in February. So that is there on this slide. And some of the other regulations are listed there that they may cite issues if they see it in a surveyor may see in a facility related to CDI. Next slide, please. And then just a list of resources here. So thank you so much for your time. Jesse, I'm going to turn it back over to you.
Thank you, Lori. Thank you, Shay. Great presentations today. I'll just add in there, as we look at some of these infection prevention resources and practices, don't hesitate and don't forget to reach out to your local public health or your state health liaisons to help support your needs in your facility. Any questions? All right. Well, as always, if you guys think of anything, feel free to reach out. And there is a link for post-presentation little survey, if you wouldn't mind completing that. We love to hear from you. Otherwise, great presentations today. Thank you all for attending. Same place, same time next week. Take care and be well, everyone.